A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Hi, Dr. Uche Odiatu here, sharing with you some insights on how patients are starving for healthcare providers that look at the big picture from head to toe. Very similar to the theme of Beyond the Prophy. Let me give you an example. So just a couple of days ago, I'm in the reception area. A patient sees me from where she's sitting, comes over to the desk and says, Dr. Odiatu, I'm in for a hygiene appointment tonight, but quick question for you. What could you tell me about halitosis? And I said, well, in a nutshell, it could be from the mouth, but it also could be from your sinuses. It could be from your lungs. It could be from your stomach. So, but we'll check you out during your appointment and we'll see what's going on. I said, have you had any sinus issues lately? And she goes, yes, I'm plagued with sinus infections. She goes, I usually have 2 or 3 a year. I said, do you often get antibiotics? She goes, yes. I said, well, there's a book called The Microbiome Solution by gastroenterologist Robin Chutkin, who said that people who have regular sinusitis problems and who regularly take antibiotics decimate the good flora in their sinuses. And they have a third less good bacteria in their sinuses, which makes them even more prone to sinusitis. She goes, oh my God. She goes, what else? I said, well, do you brush your tongue? And she said, no. I said, well, some people have lots of papilla in their tongue and it collects and traps food and debris, and that could be a source of odor. But if your tongue is bald or your head doesn't have papilla, but you can still brush your tongue, for keeping an eye out for bad breath. I said, do you floss? She goes, well, I floss. I sometimes floss. I said, well, if you ever, snap your floss through 2 or 3 of your teeth, smell your floss and you'll see actually what you're missing. They actually have shown that 20% of the tooth surface area happens between the teeth, in the interproximal area. She goes, oh my God. She goes, I've been on antibiotics my whole life. I said, what do you mean? She goes, well, when I was a kid, I had tons of ear infections. I said, well, they've actually shown, this is Dr. Amron Mayer, and it had in his book, the Mind-Gut Connection, said that people who are kids, in particular, who have chronic ear infections and are on very powerful antibiotics, often are plagued with all kinds of immune system issues when they get older. Sure, you need an antibiotic as a child if your infection is bacterial and not going away. However, as a viral bacteria, there is no need for antibiotics. And many moms actually will insist to the doctor they want an antibiotic because we're going to Disney World and we want to make sure that little Joey doesn't have a flare-up. So I said, wow, that's a lot, isn't it? She goes, yes. I said, do you happen to sleep with your mouth open? She goes, why? I said, well, if you have a dry mouth, you're also more likely to suffer from halitosis. She goes, well, I snore. I said, well, okay, your mouth is open then. And she goes, yeah, my husband hates it. I said, what do you mean? I said, have you ever gone for a sleep study? And she said, well, I thought about it, but I wasn't sure if I would be eligible. I said, well, something you might want to talk about with your medical doctor, but, snoring is not just an innocent habit. It also shows that there's an interruption to oxygen flow to the brain, and over the year, decades, over a lifetime, can definitely support, cognitive decline. So this is all in the aspect of about 2 minutes of time. And I said, you know what? I said, Kelly, I can have a good conversation. I said, she goes, no, but I'm not due for an exam. She said, it's just a in-between visit. You told me the benefits of coming for a hygiene appointment more often just because to control my blood sugar. And I said, yeah. I said, well, I'll pop in anyway. Anyway, so during her exam visit, I gave her the name of a naturopathic doctor, which is a great source of alternative healing and to investigate her sinusitis, her snoring. I also said, I recommended she talk with a medical doctor about it, obviously, because also your medical doctor can send you for an overnight sleep study. But anyway, she thanked me like crazy, and I so appreciate having my interest be of benefit to patients. The hygienist overheard all the conversation. And again, it was reinforced between the two of us how we're much more than just tooth mechanics and taking care of the oral apparatus. And we felt, very fulfilled at the end of the night. We recounted what happened, and we reviewed what I recommended to her out in the reception area. But the hygienist and I, we felt great. It was just an awesome feeling to know that, we're much more than just tooth cleaners and crown preppers. And these patients really appreciate the all-round care and the total health viewpoint of healthcare providers The oral systemic link goes beyond P. gingivalis. It's amazing how it can impact every aspect. And chairside, we can definitely be the leaders in an authentic conversation. Okay, druche.com. You can also follow me on Instagram. My name is @FitSpeakers on Instagram. Take care.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to AToTHhygienist.com and subscribe to our newsletter. You can also email us at AToTHhygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.